Hello, welcome back to Wales This Week and to Prince Charles Hospital in Merthyr Tydfil. Staff on this busy A&E ward have been getting hands-on help from on high. The very top, in fact, as the Chief Executive of the Cwm Taf University Health Board leads her management team back to the NHS frontline. There's a huge question mark hanging over the very future of our health service. Ever-increasing demand and constantly squeezed funding are creating relentless challenges for management, medics and staff at every level. Well, now bosses at the health board which runs this hospital are returning to the roots of their careers to discover firsthand the pressures facing the 8,000-strong workforce every single day.
You're safe in my hands.
OK.
We're off to Ward 5.
Off to 5.
Yeah?
I think it's got to be one of the best jobs in the world.
I think it is the best job in the world, yeah.
It's 26 years since I put on a uniform, and that's a really scary thought for me.
Last year, Cwm Taf University Health Board carried out nearly 2.5 million hospital, GP and nurse appointments. It's one of the smallest health boards in Wales, responsible for providing healthcare services to almost 300,000 people across Merthyr Tydfil and Rhondda Cynon Taf. It covers some of the country's most deprived communities with the highest rates of ill health.
My name is Allison Williams and I'm Chief Executive of Cwm Taf University Health Board.
Allison is the woman at the top. She's responsible for implementing the sweeping changes which many experts say are inevitable in the health service. Keen to get first-hand experience of life on today's NHS frontline, Allison and her management team are returning to where they started their careers.
I'm committing to go back and work a shift alongside colleagues in the A&E department in Prince Charles Hospital.
My name is Robert Williams. I'm the Board Secretary, Director of Corporate Services and Governance at Cwm Taf University Health Board. My primary role is to provide advice and support to the Chairman, the Chief Exec and members of the Board on all aspects of governance. And now I'm going to do a shift with the Portering department.
My name is Linda Williams. I'm the Director of Nursing, Midwifery and Patient Services at Cwm Taf University Health Board. And I'm going to go back to work with my colleagues on the front line in district nursing, which is where I started my career some 30 years ago.
We very regularly spend a lot of time alongside people on the coalface, visiting wards, visiting departments, talking to staff. But we took the view that we wanted to go one step further by walking a mile in the shoes of our staff, by truly working alongside them. I believe that we can get a different level of engagement and understanding of what needs to be done to improve our services.
The Prince Charles Hospital in Merthyr Tydfil caters for some of the most deprived areas in the valleys. Its recent upgrade has made it home to one of the biggest and newest A&E departments in Wales, seeing almost 54,000 people in the last year. It's also where Allison is working her shift.
I'm a bit nervous. I'm feeling very rusty. It's been a long time.
And we're all a bit nervous.
But I know you look after me.
My career started in the NHS way before I was ever old enough to work. My grandmother was a volunteer with the WRVS service in Morriston. And from the age of 11, I had to go and push the trolley to help her. And I was fascinated by the whole environment of healthcare and hospitals. So when I was old enough, I tried very hard and managed to persuade the hospital that I would be able to get a part-time job as a nursing assistant. The minute I put that uniform on and walked onto a ward, I was hooked.
First on Allison's agenda was making sure those who'd been in the department for a long time were fed and watered.
Some tissue for that.
Yeah, got it.
Pop that in front of you there.
I can spend a couple of hours in a department and I don't necessarily always get a true feel for what's going on. I think if you work 8, 10, 12 hours as part of a shift team alongside people, then you see things through a different lens.
How long have you been in the department now?
Since about 3 or 4 o'clock.
This morning?
Yeah.
Oh, you're probably feeling quite tired now, are you?
whilst a lot will have changed, people don't change. Illness generally doesn't change. Compassion doesn't change. The ability to work as part of a team doesn't change. And there's going to be a lot I don't know, but I'm not afraid to ask.
Robert is starting his shift at the Royal Glamorgan Hospital near Llantrisant, and it's straight in at the deep end.
Job from A&E to 6.
A&E to 6. I'll follow you, Carl.
Robert will be working alongside porters Carl and Ziggy.
We're going to take a patient from A&E to an inpatient ward, so we're going to do a transfer. So usually on beds, you just take
It's movement of patients from wards, and we do other things like taking oxygen containers around. We do the mortuary.
We collect the rubbish throughout the hospital. We also work the post room. So a bit of everything, really. Boys do the van driving.
And the winter.
Yeah. And the winter, the 4x4s.
4x4s.
Manage.
We bring consultants in, doctors, nurses, domestics. So mostly people at the hospital go in. Mrs. Jones, I've got to go and get a pat slide now, love, all right?
A what?
A pat slide. And what we do...
I'm in my 35th year of my NHS career. I left school at 16 and joined the NHS at 16 and spent around 10 years of the early part of my career as a hospital porter. I'm a little bit anxious, strangely enough. It's a bit about, well, I haven't ported for over 20 years, so, and I think the portering world has probably moved on a little from when I was doing it.
No, that's what I mean.
And finally, it's Linda's turn. She's at the Keir Hardie University Health Park in Merthyr Tydfil to start her shift as a district nurse. She'll be taking to the roads with district nursing team leader Julie.
I started my career in 1978. I trained as a nurse in Cardiff, working on medical and surgical wards, before following my dream job to become a district nurse in the Rhondda Valleys. I have actually gone out with district nurses already, but this will actually be delivering clinical care to patients as opposed to observing care being delivered. It will give me the opportunity to talk to staff. It'll give me the opportunity to talk to patients about what it is like to receive our services as well, which is one of the most important parts of my current role, is to consider the patient experience with regards to the services that we deliver and how it feels for them. On a normal day, how many calls would you have done by now?
I think it varies from day to day because our role has changed now as team leader.
Yeah.
I tend to be more management
Yeah.
and more liaising
Yeah.
with the multidisciplinary team more, but I do more complex calls. I do any problem calls then, for want of a better word.
Yeah. I'm hoping to be able to relate to the district nurses delivering services now and to understand what trials and tribulations they have currently. Our district general hospitals, our community hospitals are very visible, but these are our invisible workforce that are delivering services all of the time in the homes of the public.
Morning!
Morning.
Morning, John. How are you this morning?
All right.
All
Hello,
right.
John. I'm Linda Williams. I'm the Director of Nursing. Thank you very much for letting me come to your home. To be able to care for people in their own homes at a time often which is very difficult for them is a great privilege and very humbling. And I'm hoping that to be able to recapture some of that.
Where are our notes, John?
Which arm are we going to use today, John? Okay, let's use this one. Okay, thank you very much. Well, this is something that hasn't changed since I've been a district nurse. We were using these when I was working as a district nurse, like Julie. How long did we say? We said 1993 was the last time I worked as a district nurse. That's a long time, isn't it? I was saying I interviewed Julie for her first job.
So it's her fault. I'm looking after you, John.
140 over 88. Is that good for you? Is it? Yeah. Good? Fighting.
For a while, yeah.
You're here for a while.
Did the doctor change any medication, John?
No.
No?
Okay. It's lovely to see you. Thank you very much, John. You take care.
Thanks for
Nice
today,
to
John.
meet
See you
you.
soon.
All
See you
right,
soon. Bye.
Bye-bye.
Bye. And off we go to the next.
As things start to heat up in A&E, how do the bosses cope with the rest of their shifts? And what have they learned?
I'm anticipating this is a little bit like the calm before the storm now, and probably going to have a very busy afternoon.
Allison, Robert and Linda are all senior executives at Cwm Taf University Health Board. Between them, they have over 90 years' experience and have all at one time held frontline roles. Today, they're leaving the boardroom and returning to the jobs that launched their careers. They're hoping to find out how things have changed and how they can help change things for the better. Chief Executive Allison is halfway through her shift in the A&E department of the Prince Charles Hospital in Merthyr Tydfil.
I'm glad to say that I came in and the staff were very, very welcoming to me when I arrived this morning. Interesting, what do I call you? What are you going to do for the day? And I said, I'm Allison and I'm going to be a nursing assistant. And that's exactly how the staff have treated me so far. Hopefully now, if they can just put the steri strips on, you can go home.
Oh, yeah.
Okay?
That's right.
Are you all right there? Are you comfortable there?
I'm comfortable, yes.
Yes? Do you need a pillow or anything behind you?
No pillow, thank you, no.
Okay. They had a very busy start to the morning. It's not unusual that there's a little bit of a lull at this time in the day as the patients from the morning start to get sorted out and move through the hospital.
Whilst they wait for beds to become available, it's up to the staff to see if ambulances can be rerouted.
And then hopefully there's 3 coming in now, 3 traumas.
See if we can divert them en route. If not, the next 3 will go down there.
1,400. Okay.
Just
so one is 21 minutes away and the other's 31 minutes away.
So you've got a little bit of
leeway.
And maybe enough time to divert them down to the Royal Gam as well.
Possibly. I'll go and speak to them now and see if they can divert them.
Back at the Royal Glamorgan Hospital, there's no time for a break, as Robert is finding out just how tough the job can be.
How long ago was you last in here? Is it?
When we finish the job, the patient, as soon as we put the patient there, we end up getting a phone call in to them, and then they phone us back and tell us to go and do another job. Literally, what is it, about, we can be out 4 hours flat out before we have a break. Because it's, you know, that's the way the job goes.
You're safe in my hands.
Okay.
We're off to Ward 5.
Off to 5.
Yeah? Okay. You've got a noisy wheelchair, I'm afraid. We're transferring the ward today, ready for some ward moves over the weekend. So I had to transfer a delightful gentleman, Mr. Davis, from Ward 15 to Ward 5, which is where they're temporarily moving. It's my first job unsupervised. I've met some very lovely patients and relatives today. It can be a bit of a daunting place being in hospital when you're unwell. And I think those patients that are able to enjoy, as Mr. Davis did, the conversation on the way down. You recommend me then?
Yes, I'd recommend you, Rob.
I come back to move you towards 4.
Yes, that's right.
It's nice to meet you. Good luck. See you again. Because when you think of a hospital, particularly today, in terms of how busy it is and the flow of patients that go through it, you know, it's reinforced to me how key the porters are in that pathway. You know, they move a lot of equipment, but they move a lot of patients as well.
Yeah.
And if you haven't got that part of the service right, then that can create pressures within the hospital, and the hospitals are already under a great deal of pressure, so they're a key vehicle for us. I think we probably don't fully understand, appreciate, and sometimes underestimate the role of the portering department. You do see and experience some difficult situations, and often you can be the first point of contact with a patient after they've had bad news, or with a family after they've had a significant trauma or even a death.
I don't think people realise what our job entails. They see us pushing patients around, yeah, but there's other things that we go and do. There's things that I've seen that people will never ever see in their life. You can literally go and pick a patient up, and we're the first ones ever to they tell them they've got cancer, or they break down. They haven't even told their family, because we've just come, taken them off the ward, and they've just been told by the consultant what's going on. But then you've got to go home then to the wife, and the children, and you think, oh, you can't tell them. You just can't. You don't take it home with you.
They are pushing for community care because it is the future, isn't it?
Yeah,
it is. Community care is going to be the future.
Well, the policy drive is to get much more out into the community, as close to the patient as possible. That needs
and all
to be
the new
done.
initiatives, to keep patients at home.
Out on the road, Director of Nursing Linda is also having key conversations about the realities of district nursing.
To have a system that works between health and social for the benefit of the patient.
So people are assessed once, and all that information is available to be able to determine what care that they need.
Exactly.
Really. I think that the harsh reality of delivering care alongside people leads you into different conversations, and actually it's much more real for them, the fact that they can have a one-to-one conversation with me, as opposed to it being within a boardroom or a meeting setting. Our second call of the day, we met a very delightful couple who'd been married for 67 years, and they were clearly very mutually dependent with one another.
Good morning.
Hello.
Everything all right?
Yes, thanks.
This is Linda.
I'm Linda, I'm the Director of Nursing, and I've come to see to your husband today with Julie. There I actually undertook a dressing and dressed a little area on his knee.
Because he's hard of hearing, we need to write everything down for him. So I wrote down who you are and why we're here, and he knows you can do your knee.
I'm just going to do your knee, OK? Just this one.
Just that one.
Just the one.
I think it's advantageous for them to see the challenges that we face on the ground. Just from the call centre we have, the system we have for referring patients, you can come in, you can have up to 20 calls to deal with. And going back to basics today.
Courtesy now.
Going out and visiting people in their homes and meeting them, I think that, the job for her, I think she felt was just the same. But I think the discussions are more beneficial, to her as well, that we had in the car on the flu plans, the policy drivers. We could both, from her point of view, she could tell me what policy drivers were driving district nursing, and I could discuss the challenges on the ground, as it were. So yeah, we had a good discussion.
And that they repeat for it.
Back at A&E, it's all hands on deck as a suspected spinal injury is brought in by ambulance.
The nurse in charge of the department will constantly be deploying the resources according to need. So I will have been moved into the majors department when it's more busy and they've needed my help. And then when the minors department is more busy, then I've moved across there.
Took a blow to the top of the head. She's gone down, lost her consciousness briefly for about 2 minutes.
With the trauma patient that came in, had to be part of the team ensuring the safe handling of that patient, log rolling somebody with a possible spinal injury so that we protect their spine while the investigations are being done. I went with that patient to the CT scanner so that we could determine exactly what the nature of the injuries were.
Anything hurting you there or just feeling it?
Just feel it there.
It's not hurting you?
No.
I think I'm very privileged to be the Chief Executive of Cwm Taf Health Board, because I think that we have an organisation that has a set of values that go very deep into our community. We're working in a very challenging community. We have a legacy and a history from the harsh industrial part of this community which carries a lot of ill health. But what we have in the organisation is an ability to work together to maximise the potential of the services that we provide. And the orchestra is in tune, but we don't always get it right. And I think good organisation is to be constantly striving to get it right, but when it gets it wrong, to put its hands up, to recognise that we can do better and to work with people to improve.
Is your blood pressure normally okay? Yes, back up again, okay.
So, has it been a success?
There's a lot of things she's picked up. Obviously there's a bed crisis, that's an ongoing, so obviously she's looking into that. But things like over in Miners, where the nurse has to go down to the waiting room to call the patient, so we're looking at a different system there. Things like that which she wasn't aware of.
And I started my career portering, so just keep an eye on your elbows.
You know, fitted in well, didn't he, you know.
And he went out of his own. He went out of his own, and you could see it, he was enjoying it. And the thing was, he was in a porter's uniform, so no one on the wards knew who he was. So they were speaking to Robert as a porter, not as a director. Yeah. You know, and I think he enjoyed it. I honestly think he enjoyed it.
It's like riding a bike, see that, you know.
Yeah. Starting to get back into the hang of it. Yeah, I'd forgotten how tiring it can be, because I've walked quite a bit today, but not as much as they've walked. They've tolerated the disruption I've caused, but have helped me along the way as well. They're all very enthusiastic. They speak very highly about the job and the role they've got. And I think we're very fortunate to have them. Being inpatient from the ward?
From Ward 6?
Yeah.
And what's the name? The only thing that's ever constant in the health service is change. Our staff are constantly having to deal with new pressures, but also with new opportunities. And really, the whole purpose of this exercise and what we need to do to make the service the best that we can for the population of Wales is that our staff are part of that change. They are the people that are delivering care day by day. I can't sit in my office and affect in a direct way what goes on the shop floor. I need to work with the people, like the people you've seen in this department today, and together we will make the services for our patients in Wales better.
I'll certainly do it again. I've already promised Julie that I'll come back out and not be followed by a camera.